Good afternoon and welcome to Frequently Asked Fridays, where if you've got questions, we've got answers. My name is John Bonina of Bonina and Bonina PC, and today we will be answering all your questions concerning birth injuries. The most frequently asked question we get when someone's child has a birth injury is, was this preventable? And in many cases, of cerebral palsy, injuries and birth injuries and the brain injury that occurs with cerebral palsy was preventable. And in almost every case of Erb's palsy or brachial plexus injury, as it is sometimes known, in almost every case of Erb's palsy, it's not only preventable, it is both, that brachial plexus injury is both predictable and preventable. So let's talk about Erb's palsy first. What is it? I mentioned a medical term, brachial plexus injury. And what that is, the brachial plexus is a series of nerves at the bottom of your neck, coming out of your cervical spine, your neck, going to one arm and to the other arm, and the upper part of your back. So it's your last four, C5 to C8, spinal levels in your neck, and T1, the top one in your upper back. And those five levels and the nerves that come out of those five levels are considered the nerves that make up the brachial plexus. When that gets injured, and it can be injured when a doctor panics during childbirth, that can unfortunately lead to a permanent nerve injury affecting one arm or the other. When that happens, the child's arm may be shorter. The arm may not grow correctly. It will certainly have different musculature and different movements. So some children with good recovery can lift their arm above their head. Some children can never get it past, like, I'll move this camera down like this. So, and that's it. That's the best they can do if they have an injury to the nerves of those brachial plexus and Erb's palsy injury caused by a doctor panicking and pulling on their head and neck to affect delivery. Look, the ability of a woman to bring a child into this world, to deliver a child, is literally one of the miracles of medicine and really of human life. But everything can go wrong in an instant if the doctor panics and if the doctor doesn't do the right thing. And that unfortunately is what happens. Panicking, pulling on the head, in a panic, that leads to almost every diagnosis of permanent Erb's palsy injury. You can think of it as a passenger passageway problem. The passenger is the baby, and the passageway is the birth canal. In 99% of deliveries, the baby moves their way down the birth canal. Sure, they can take 2 hours, sometimes even 3 to do so, but the baby does so through the force of the mother's contractions. However, if the passenger is too large for the pelvic outlet, the passageway, the baby's shoulder can get stuck on the pelvis. So now let's talk about the passageway a little bit, because we've talked about the size of the passenger and the size of the passageway. So with the passageway, the birth canal, it's actually wider than it is, if you picture it like this, it's wider than it is top to bottom, which is relevant in terms of how these children can be effectively and safely delivered. Now, the widest part of the child, the passenger coming through that passageway, is their shoulders. So what can happen as the child is coming down, if you go back to that analogy, that top shoulder can get hung up on the pelvic bone and can get stuck. When that top shoulder gets stuck on the pelvic bone, it's something that needs to be dealt with, and dealt with correctly in order to avoid a permanent nerve injury to that child. The medical term is shoulder dystocia, and what that means is simply difficulty in delivery with respect to the shoulder. So how and why does that happen, and how and why can a physician deal with it? Well, the first thing a doctor can do when that shoulder is stuck on the top of that pelvic bone is flex the mother's legs up. So you've often, if you've been in the delivery room, you know they often move the mother's knees up almost all the way to her chest. And you think, well, what does that do? Well, if you think of the curvature at the bottom of your spine, it flattens out the bottom of the spine, which is the base of the birth canal, the base of the pelvis. And by flattening it out, gives the birth canal approximately another centimeter to effectively and safely deliver that child whose shoulders are too big to get through. If that doesn't work, the next thing, again, the shoulder, in this case my thumb, is stuck on the top of the pelvic bone, in this case my finger. So what the doctor can do is do something called suprapubic pressure. Basically push down right above the vaginal opening, right above where the baby's shoulder is in the pelvis. It's critical that it's the pelvis. And that can sometimes dislodge the shoulder, move the shoulder down, and free the child. And we've seen this sadly, the doctor doesn't push at the pelvis, but instead pushes up here at the top of what's called the fundus, or above the woman's pregnant stomach at the top of it. All that does is further jam the shoulder in and starts to begin to pull the shoulder down and create an angle away from the head, which can run the risk and increase the risk of developing a permanent nerve injury to those nerves that go out to the arm. Crazily, I've had depositions where, in medical records, where doctors admitted to pushing at the top as opposed to the bottom. I once deposed a physician out of state to ask what he observed the other doctor doing, and I said, what did you see next? And it was Dr. X performed fundal pressure, and my clients had described something extraordinarily detailed to me, so I asked the next question, can you describe how Dr. So-and-so applied fundal pressure? And this is a resident who had moved out of state, said, with his knee. That's a full body weight coming down above and pushing that child's shoulder further into the pelvic bone. And I said, how do you remember this however many years later? He says, I've never seen it before, and I've never seen it since. Well, sometimes you have to ask those questions, and when you ask the probative questions to try and get information, cases like that, in that particular case settled not long after that deposition. Now, if pushing down in the pelvis, the suprapubic pressure, and flexing the legs up to the chest doesn't work, there are other maneuvers that can be done. For each of these maneuvers, internal maneuvers inside the mom, it's beneficial to perform an episiotomy, and what the episiotomy does is give the doctor a little bit more room within which to perform those maneuvers. The first maneuver is something called a corkscrew, and it's just what you think. If this is the pelvis, the doctor reaches fingers in, takes two fingers and puts them on the back of the lower shoulder. You don't want to mess with the upper shoulder because it's impacted, and sweeps it so that you're literally corkscrewing the child. The child is turning in the birth canal, and the angle of the shoulders are turning, which go back to the dimensions of the birth canal. It's wider than it is top to bottom, so if you rotate that child, you may get the shoulders into position where they can be delivered through the wider part as opposed to the smaller dimension of top to bottom. That's called the corkscrew maneuver or the Woods maneuver. If corkscrew doesn't work, there are some other things that can be done. The doctor can reach fingers in and deliver, again, the posterior is the word doctors use, the lower arm. You reach in, you literally deliver the arm, pull it out, and when that arm and shoulder are delivered, now what happens is the rest of the baby follows. So the baby can be safely delivered. Sometimes you break the baby's arm doing that. And I'm here to tell you, as brutal as that sounds, it's actually not terrible. And the reason is this: bones heal faster than nerves. Nerves, when cut, severed, torn, do not heal. Bones, especially in an infant, heal very, very quick. So that broken arm, if God forbid that does happen, will be long since healed before that child is rolling over. They healed within a month or 6 weeks, whereas the nerve injury can sadly last a lifetime. So you take the broken arm over the nerve injury every single time. And one of the last moves that can be done is something, literally break the clavicle, the collarbone. And if you think, why would you do that intentionally? Well, if every other move has failed, and there is a clock, the clock is approximately 4 minutes before the child begins to get oxygen deprivation to their brain, which is something else we'll talk about in a minute. But if you're getting out to 2.5 minutes, and every other maneuver has failed, you fracture the clavicle, the collarbone, and literally what can happen is the bones can collapse, slide down on each other. Now you have the extra centimeter, maybe 2 centimeters. Maybe you do the suprapubic pressure, pushing down on the pelvis again, and you should be able to safely deliver that baby without any nerve injury. The bottom line is that the science tells us, the research and medicine tells us, that if a child suffers a permanent injury to the nerves of the brachial plexus, a permanent Erb's palsy injury, it can only happen one way, and that is if the doctor takes the head, pulls on the head, and by pulling on the head, changes the angle between the head and the neck, thereby stretching those nerves, and in stretching them, causes a complete or partial tear. That is the only way a permanent Erb's palsy injury can occur, and it is entirely, totally, and completely avoidable. It's predictable, and it's preventable. So I mentioned oxygen deprivation a few minutes ago. Cerebral palsy can occur in the case of oxygen, when a child is deprived of oxygen in the delivery process. And we'll talk briefly about this because it's a very complex area of medicine. But science, medicine, and research do tell us that 20 to 25% of cases of cerebral palsy could have been prevented if the mom was monitored more closely and delivered as soon as signs of oxygen deprivation set in, as opposed to well after. So babies get their blood supply from their mom. They get blood and nutrients from their mom through the placenta. How does a baby's blood supply and thereby their oxygen supply get cut off or cut short? Because either one of those things is bad. As I mentioned before, 4 minutes of no oxygen will make you brain damaged. But the bigger issue with oxygen deprivation in the delivery process is usually not a complete deprivation, but a partial deprivation, which can occur over a period of time and result in oxygen deprivation, brain damage, and cerebral palsy. So the baby, if the placenta separates from the mom's, from the womb, from the uterus, that can result in a decrease or a complete cutting off of oxygen, depending on how much of the placenta separates. If the cord, the umbilical cord, gets kinked, maybe the baby's lying on the cord and it's blocked, and they don't move the mom or don't shift the mom's position, or it doesn't recover when they do. If the baby's umbilical cord is wrapped around their neck, sometimes people hear cord around neck and they think the baby's getting suffocated. Actually, the baby's not getting suffocated that way, the way that you would ordinarily think. The baby's getting suffocated because in so doing, that umbilical cord is being stretched and kinked, and the oxygen and blood supply going through the umbilical cord to the baby is being cut short. How does a doctor know? Fetal heart monitoring. Fetal heart monitoring, whether it's an internal monitor or an external monitor, is there for the baby's protection. That's exactly what it is. Fetal, baby, heart, we know what that means, and monitoring. Having the machine on isn't enough. The doctors and the nurses and the healthcare providers present at that labor and delivery must pay attention to the results. And if those results show either the heart rate going down, can be a potential significant problem, that's called decelerations, or the heart rate going up, that's a sign your heart rate goes up as a grown-up when you panic. And if the baby is suffering from tachycardia or a significantly increased heart rate above the upper limit of normal, that can be a sign of oxygen deprivation and fetal distress as well. The bottom line is your baby's heart rate should be 15 beats plus or minus, so the wave that we see. Somewhere, the baseline is the word they talk about, the average should be somewhere between 120 and 160. Some doctors say 110 and 160. No one's going to make a case over a baby's heart being 110, but if it starts dropping down below 100, it can be a sign of oxygen deprivation that requires A, closer monitoring, and quite likely B, rapid delivery. And that rapid delivery can include cesarean section. And you say, how rapid? Well, in the medical community, there's a saying, 30 minutes from decision to incision. From the time you decide we need to do a C-section to the time the cut occurs and the baby is out, at most 30 minutes. And that was the standard of care 25 years ago. Now, it's a lot faster, and in most cases we see decision to incision somewhere between like 9 and 17 minutes once that happens and when we're reviewing records with cesarean sections. So that's what can be done to prevent cerebral palsy, is get the child out of the toxic environment where there is either infection or diminished oxygen being delivered. What other types of scenarios do we see? What other types of scenarios can result in catastrophic injuries to children that give rise to litigation? Well, one, sadly, and we see it in situations with minorities and socioeconomic disparities and socioeconomic issues, they get turned away from the emergency room. Mom at 9 months saying she's in pain, they don't want to see her, they don't want to talk to her, they send her home. And we've had multiple cases where that's happened, and they deliver like on their bathroom floor or something. That's not good for the kid. Also, if a vacuum extractor is used during delivery, the doctor has to be careful to make sure it goes on the dome of the head, on the top of the head. If it's placed over the face or eye, you can get a permanent nerve injury to the face, and permanent means just that somebody's going to have a droopy one side of their face or eye for their entire life because the doctor simply didn't feel to make sure where they were placing that vacuum. We hope these things never happen to you or to anyone in your family or to any loved ones. But if they do, we're here to answer your questions. Thank you for joining us, and please join us next week when attorney Erin Peak, who works on our child sex abuse cases, and paralegal Joy Donaldson, who also works on those cases, will be bringing you the information and answering all your questions on digging up dirt on the bad guys. And digging up dirt on the bad guys is what Erin and Joy do very often and very well in those cases, and they'll share some of their secrets with you and answer all your questions on that subject. Thank you once again for joining us on Frequently Asked Fridays, where if you have questions, we have answers. Have a great week.